Good evening, everyone. Welcome to our assessment time. We are now on Module 4, Week 5, and today we're going to talk about the lung channel or review the lung channel of Han Tai-Yin and the large intestine channel of Han Yangming. Okay, so are you all excited to be CAA? Ang gagaling nila. Okay, before we start, review muna natin yung Han Tai-Yin lung channel. Why is it important to be very detailed when we discuss the lung channel? First, we start with the primary channel. Okay? Tingnan niyo po mabuti ang diagram. So the primary channel begins in the region of the stomach. Okay? Okay, so take note, the lung channel begins in the region of the stomach or middle burner. So it actually starts in the middle burner and then it passes downward to connect with the large intestine. So tingnan nyo, bumababa siya. Can you follow? Then returning back upward, it will cross the diaphragm and then it will enter the associated organ, which is the lung. Okay? Emerging transversely from an area between the lung and the throat, it descends along the anterior aspect of the upper arm. Then, reaching the elbow, it continues along the anterior aspect of the forearm to the anterior margin of the styloid process of the wrist. At the wrist pala. Okay, from there, it crosses the radial artery at the pulse, then it extends over to the thinner eminence, to the radial side of the tip of the thumb. A branch splits from the main channel above the styloid process at the wrist, and then this travels directly to the radial side of the tip of the thumb. So ito po yung primary channel. I'm sure you've mastered this already. What is the clinical importance of knowing the exact pathway of the primary channel? No? So here we can distinguish whether the disease is exterior or interior. So the signs and symptoms of an exterior illness is fever, aversion to cold, alam na natin yan, nasal blockage, headache, pain in the region of the thorax, shoulder and back, pain with cold sensations along the channel. So you try to always extract from your patient na meron po siyang cold sensation along the channel. So that's actually exterior. Pag interior naman, meaning to say, the organ is already affected. Nasa organ na. Interior na eh. So the signs and symptoms are cough. So if you notice, if it is an exterior condition, it doesn't necessarily have cough, no? Pag interior na, parati ka na nakakaroon yan before. You can even have asthma, just like Ma'am Lynn, no? Is it okay? Okay. You'll have wheezing, dyspnea, shortness of breath, fullness and tightness of the chest, may laman yung throat, expectoration of phlegm, dry throat, and then you will notice that the color of urine changes. You have irritability, no? Heat sensation in the palms, abdominal fullness and distension and diarrhea. Okay. Another is to be able to determine between excess and deficiency condition. Now, if the primary channel is involved, pag excess po siya, you'll have shoulder and back pain. No? Also in deficiency, but the cause would be different. So in excess, you will have wind cold attack with spontaneous sweating. Okay? Kasi humina bigla. No? So hindi na nagsara yung pores. There will be frequent urination and yawning. So if it is a deficiency condition, there is also shoulder and back pain with aversion to cold. Okay? Aversion to cold. Ayun mo talaga na, kahit anong gawin mo, hindi talaga nawawala yung cold. Shortness of breath, changed color of urine. Okay? Now let's go to another channel, which is called the luo connecting channel. So as you can see here, the luo connecting channel separates from the primary channel at what point? Lung 7. crossing over to that point in the large intestine called LI4. Another branch will follow the lung channel into the palm of the hand, where it spreads through the thinner eminence. So what is the importance of knowing the LU channel? Okay, again, this is something to do with pathology. It's between excess and deficiency. Pag excess, no, involvement ng LUA channel, so syempre, if you remember nasaan yung LUA channel, nasa wrist, di ba? Palms and wrist, there will be hot and burning sensations in the palm and wrist joints. Pag deficiency, yawning, shortness of breath, frequent urination, and enuresis. Okay? Now, another channel, I hope you don't get confused yet, is the divergent channel. Divergent. So, this channel diverges from the primary channel at the axilla, kilikili. Then it travels anterior to the path of the pericardium channel into the chest, where it connects with the lung before dispersing in the large intestine. And then a branch proceeds upwards from the lung, emerging at the collarbone. Okay? From here, dito pa rin collarbone. From here, it ascends across the throat, where it converges with the large intestine channel. Yan po yung divergent channel. Ano po ang significance nito? Again, pag excess, you will have hot and burning sensations in the palms and wrist joints. It's the same, no? Kasi divergent, LUA connecting, and deficiency, there will be yawning, shortness of breath, frequent urination. Now, let's go to the lung sinew or the lung muscle channel. No? If you notice, malaki talaga yung area covered by this channel, even bigger than the primary channel. So where does the lung sinew channel begin? Nagbibigin siya on the thumb, and then after connecting with the thinner eminence, it crosses the wrist at the pulse. Okay? Can you follow? Then it proceeds along the forearm, connecting at the elbow. From here, the channel continues up the medial aspect of the arm, then it enters the chest cavity below the axilla. Okay? Emerging again in front of the clavicle, the channel connects at the front of the shoulder. Above, it connects with the clavicle, and then below, it connects in the lung, spreads over the diaphragm, as you can see here, and converges again at the lower rib. Okay? What is the clinical importance of knowing the sinew or the muscle channel of the lung? Okay, pag may pathology, no, there will be stiffness, cramps, and pain along the sinew channel. So sometimes it's difficult for you to believe kasi abot na po sa chest. Yun po yung sinew channel po ng lungs. Okay? So there could be spasm and pain in the thorax and hypochondriac region. In severe cases, magkakaroon na po ng mga nodules below the right lateral costal region and distension along the lateral costal region. So indication po ng lung sinew channel is for painful obstruction syndrome along the lung channel or P syndrome. So if you were very observant kanina, the area covered by the lung sinew channel is greater than the area covered by the lung primary channel. So this explains why indications ng mga points on the lung primary channel will include disorders and diseases of the chest and hypochondriac region. Okay? Huwag na kayo mag-isip. Let's now proceed to our exercise. Let's call on... Sinong gusto mag-volunteer? Si Dr. Sam?
Hindi na ko po kung may sagot po ako, Doc. Ay, parang wala. Mali-mali po yung sagot ko, Doc. Kaya sa next na lang ako.
Ni-research mo ba?
Yes, Doc. Pero ang nakakalito kasi yung mga dahil yung tinitingnan ko po na parang feeling ko parang pare-pareho lahat yung nakasulat. Sore throat, mga ganun. Coughing.
Okay, di bale. Sa primero lang yan. Tinan mo si Sir Albert, memorize lahat yan, no? Including the Okay, let's go to, maybe we can call on, who would like to volunteer? Okay, as usual, napansin ko kanina while I was listening to the other webinar, Miss Angel ko, Angel,
Yes, Doc.
can you show your
Good
face?
evening po, Doc.
Good evening. I'm sure ready ka. Bakit hindi face yan? Mamaya may guest tayo, kailangan makita ang mga mukha natin lahat, okay?
Naglag lang, Doc. Naglag.
Okay, go. Ma'am Angel,
Yes, Doc. Good evening po, Doc.
good evening. What's your
So,
answer for number 1? Lung 5.
number 1 po, sa lung 5 po, answer ko po is drains heat in the lungs, coughing, asthma, pneumonia, and bronchitis po.
Okay.
Sa letter D po, Doc.
Okay, very good. Bakit? Anong classification ni lung 5?
Si lung 5 po kasi, Doc, ay sedation point po siya. Has a point po, water.
Pangkande. Okay, very good. Can you continue with number 2?
Number 2 po,
7.
Doc, lung 7. Lung 7 po is dispersed wind, common cold, headache, urticaria, facial paralysis, and stiff neck po.
Okay. Maganda
So,
siya
lung
for
7.
wind.
Letter C po.
Yeah, what is the classification of lung 7?
Lung 7 po, Doc, is ano nga ba to? Lung 7
Command.
is
Wala pa pala tayo niyan. Command, no?
Apo.
Okay, did you Google lung 7?
Lung 7. So, Doc, lung
Hindi
7,
ko
no?
Hindi ko naman
Lung 7 is luo connecting point of the lungs.
Yes. Luo connecting point of the lung. So, ibig sabihin, it can affect the large intestine, no?
Yes po, Doc.
Yeah. So, pag masyadong excess, lalo na pag masyadong mahina yung immune system, pwede mo gamitin yung lung 7 para may impact siya kay large intestine. Very good. Number 3.
Number 3 po, Doc, is number 3. Lung 3. Lung 3 po is answer ko po is letter A, window of sky, bronchitis, asthma, pain in medial upper arm po. Lung 5 is a window of sky po siya. Ay, lung 3 po pala, Doc. Lung 3.
Would you know how to
Sorry.
Okay, would you know how to locate lung 3?
Lung 3.
Alam niyo ba,
Location.
iganon mo lang yung ilong mo, ilagay mo dito sa braso mo. Yan na po yung lung 3.
Okay.
Now you know.
Ganun po pala yun.
Easier.
Oo. Lalo na pag may amoy. Oo. Ikaw pala magtutusok. So, amuyin mo. Hindi pala. So, hindi mo pala dapat amuyin. Siya na yung aamoy. Okay, number 4. Lung 9. Classification.
Lung 9 po. Okay. So, si lung 9 is shoestring and U1 source point of the lungs.
Okay.
Apo. So, lung 9 is answer ko po is letter E po, eliminates wind and transform phlegm, chronic bronchitis, influence a weak pulse.
Yeah. Another identity, how would you call this? Another basta special feature po ng lung 9 is it is an influential point. No?
Yes po. And
So,
tonification point.
Yes. Lahat ng mga circulation issues, 'di ba? Naayos niya, lalo na pag malamig yung kamay. Good. Number 5, lung 10.
Lung 10 po.
Classification.
Classification po ng lung 10 is Ying Spring, fire.
Okay.
And answer ko po is lung 10 ay F po. Letter F. Benefits
Very
the throat,
good. Sore throat.
sore
Yeah.
throat, hoarseness, infantile malnutrition.
Very good. Number 6.
Number 6 po,
7.
Doc. 6, lung 11. So si lung 11 ay Jingwell Wood, Ghost Point also. Answer ko po kay lung 11. Lung 11 is letter G po, benefits the pharynx, tonsillitis, and revives from fainting po. Kasi Jingwell point po siya.
Yeah, ito talaga yung kasi nasa dulo, no? Revive from painting. Sometimes you don't have to stay too long on one statement or on one phrase. Ano ba tawag dito? Yeah. You have to look at the descriptions. Okay, number 7, lung 6.
Lung 6 po is she cleft point.
Okay.
She cleft point, and my answer po is letter B po. Suppressed rebellious lung chi, coughing, pneumonia, hemoptysis, and nosebleed po. Letter B po ang answer po.
Okay. What is a she point or she cleft point or an accumulation point? Dito po nag-converge ang
Yung she
diba?
cleft, yes.
So pag may pain, napakaganda nito. Actually, very sensitive si lung 6. Pag meron kang pneumonia or, nag-nosebleed. And one special feature, now lung channel is a yin channel. So ang maganda nito, it also treats blood issues. Unlike sa yang she cleft. Okay? Kaya meron tayong hemoptysis. You know what is hemoptysis? Hemoptysis, sumusuka ka ng dugo. Okay? Hindi pala sumusuka. Hematemesis pala nagsusuka ng dugo. I'm so sorry. Hemoptysis, umuubo ka ng dugo. Hemo, blood. Okay? I want you all to get used to medical terms. Okay? We're going to be medical acupuncturists. Hemoptysis. Hematuria, blood in the urine. Hematemesis is nagvomit ng blood. Great. Nosebleeds, epistaxis. Yes? Excited? Thank you very much, Ma'am Angel. Now
Thank you, Doc.
to the next one. Sino pa ba yun? Okay, sinong gustong higitan si Ma'am Angel? Of course, papakapin natin to.
Si Doc Sam po.
Okay, Doc Sam. Ay, madali lang.
Talaga?
Oh,
Okay.
Doc Sam, 8 to 14. Go.
Okay, good evening, everyone.
Good evening.
The front move point of the lung is lung 1. Yeah,
Okay.
it's the lung 1. And also the
Fire point of the lung.
fire point of the lung is lung, I think it's lung 10.
No, you
It's,
should never say, I think.
But ano daw?
You are definite about your answer.
Yes. So the fire point of the lung is lung 10.
Okay, lower
And
point
the
of the
lower
lung.
connecting point of the lung is lung 7, as we have mentioned earlier.
Yes.
And also the horary point of the lung, which is lung 8.
Very good. Confluent
Lung 8.
point.
The confluent point is lung 7. No, sorry. Yeah, lung 7.
Lung 7.
The confluent points of Ren coupled, especially coupled with kidney 6.
Let me explain a bit about lung 7. Confluent point. This is the parang end opening point. Conception vessel is an extraordinary vessel. So pag may issue po siya, gamitin mo lang lung 7. We usually pair it with kidney 6. Okay? Lung 7. Yes. Source point of the lung.
Yeah, the source point of the lung, I think it's no, sorry. The source point of the lung is lung 9.
Okay, number 14.
Lung 9, yeah. This is good for chronic and deficient problems, and best point for phlegm. So that's also the answer for, I think it's number 14. Hi, Doc, I have a question regarding this number 14.
Okay.
Because if there's a lot of phlegm, we usually use also a stomach 40. Can we combine stomach 40 with,
of course,
lung?
Of course.
Pwede, no? Pwede.
Yes,
Okay.
stomach 40. Or even
So
spleen.
that's the answer.
Even spleen.
What is the spleen 9? Yeah. Oh.
Yeah. Ang galing. I'm so proud of you. We're all so good. Thank you very much,
Dapat po
Doc.
pala sinabi ko, ako na lang. Doon pala po ako may sagot, Doc.
O, diba? Sa next, ikaw na. Okay, great. I'm really, really excited. Next. Okay, let's review. Lung 1 po, ito yung front view point. So when you press this point, it's going to be a bit tender. But you have to be careful when you needle this. I think you're aware of the danger involved, no? Kasi may nangyari kasi daw, definitely not sa lung. sa isang ano pa naman yon kung saan nag-i-intern yung mga ano. Ewan ko lang kung totoo, baka marites lang. Ni-needle yung front mo, ang laki-laki, ang haba-haba ng needle. So, nagkaroon ng emphysema, no? Nagkaroon ng ano yung lungs niya. Yun, ng air. Okay naman. Okay. Lung 5, we use this for excess and heat problems. This is the Hussey point of the lung. Very good. Okay, lung 6, also for excess, heat plus bleeding, coughing, blood. Lung 7, luo connecting, no? External wind, common cold, chronic sore throat. So if you, this is like, when you needle this, may impact din po siya sa large intestine. Lung 9, chronic and deficient problems, best point for phlegm. Lung 10 is for acute sore throat. Lung 11 for tonsillitis, revival point. Good? Okay. Any questions for lung channel? So I presume you have mastered already both the pathways and the points. Okay, so next we go to Han Yangming of large intestine channel. So first, let's talk about the primary channel. Okay, saan nag-uumpisa ang primary channel? Okay, nandito po siya sa tip ng index finger, radial side, no? Then it proceeds upward between the first and between the first and second metacarpal bones of the hand. It passes between the tendons of the extensor, pollicis, longus, and brevis at the wrist, and then it continues along the radial margin of the forearm to the lateral side of the elbow. Okay, then it rises along the lateral aspect of the upper arm to the shoulder joint, and then it crosses behind the shoulder, following the anterior margin of the acromion before turning upward. And then just beneath the spinous process of C7, you know where that is, the channel enters directly into the supraclavicular fossa, and then it connects with the lung. So my connection is to the lung, no, before descending across the diaphragm to the large intestine. Do you remember yung kanina sa lung? So a branch separates from the main channel at the supraclavicular fossa and then moves upward through the neck. Ito na yung nag-ibang landas. Papunta na siya na sa neck, crosses the cheek, so opposite cheek, opposite, no? And then it enters the lower gum. So always remember, pag L, large intestine, pag sumasakit yung lower teeth, nag-bleed yung lower, or merong swelling of the lower gum, use the large intestine point. LI4, LI11. From here, it curves around the lip and intersects the same channel. So what is the importance of knowing the primary channel? Again, as usual, we need to know pag exterior or interior, no? So since magka-related lang po silang in large intestine, you would notice some similarities, but more emphasis on the mouth, the throat, diba? May fever din, dryness of the mouth, thirst, sore, and swollen throat, nosebleed, toothache, red, painful eyes, stiff fingers, painful cold, or painful hot swellings of upper arm and shoulder. Now, pag interior po, that means the organ is already involved, the large intestine. There will be pain in the lower abdomen, borborygmus, okay? Diarrhea or yellow stools with mucus, shortness of breath, and dyspnea. Okay, pag excess, there is heat sensation along the LI channel. Pag deficiency, there is cold sensations and chills along the channel. Okay? So those are the things that we need to remember. Bakit importante na ma-memorize natin po ang primary channel ng large intestine. Next, the luo channel. Okay? The luo channel separates from the primary channel. At what point? What do you call this point? Anyone? LI6, no? On the wrist, and then it joins, okay, with the lung channel at lung 9. Okay, so it's the LI na umalis dito sa LI6, then magjo-join siya ng sa lung 9 para sa lung channel. Another branch follows the arm to the shoulder, crosses the jaw, see, and extends to the teeth. Diba? Another branch separates the jaw, and then it will enter the ear region. So teeth and ear. So that's the luo connecting channel of the large intestine. So I presume you already know the clinical significance or clinical importance of that. So for excess conditions, pag disorders of the teeth and gums, you would know what pathway is involved, right? Disorders of the ears, diba? Yung isa papunta sa teeth, yung isa papunta sa ears. Pag deficiency po, especially pag kailangan mo na ng yung isang brand ng toothpaste, we won't mention, sensitive teeth and gums, okay. Sometimes if you just keep using the toothpaste, wala kang inayos naman sa acupuncture, hindi mo titonify, diba? Do you get me? So papalik-balik lang, kung sa bagay more sales, but what is important is narirelieve naman. So it's basically a deficiency condition ng LI luo connecting channel. Sensitivity to cold. So hindi makakain ng ice cream ng mga malalamig. Sensation also of tightness in the chest and diaphragm. Okay? Next, we go to the divergent channel, ang lumihis ng landas. Okay? After separating from the primary channel on the hand, okay, here, this divergent channel continues upward across the arm and shoulder to the breast. Okay? A branch diverges at the top of the shoulder, enters the spine at the nape of the neck, then proceeds downward to join with the large intestine and lung. Another branch ascends from the shoulder along the throat, emerging at the supraclavicular fossa, where it joins the primary channel. So clinical importance ng large intestine divergent channel, it strengthens the connection between the lung and LI. Remember, they are interiorly, exteriorly related. So the two organs are actually connected, no, intimately. Points on the LI primary channel, we can therefore use them for disorders of the lung. And also yung points on the lung primary channel, pwede natin gamitin for treating disorders of LI. So basically, ang mangyayari niyan, especially mga skin problems, no, pwede mong gamitin yon. But again, you will not be using the channel. So you might be wondering, bakit? Okay, I'm sure you've heard of acne vulgaris, no? Ano pa ba? Yung mga may excess, may mga, shall we say, yung psoriasis. We don't use the channels on the LI or the lung, no? We use other points. But this one kasi, if you treat the organs, no? You use the divergent channel. A branch of the LI divergent channel will spread from LI15 across the thorax and breasts, thus extending the actions of points on LI primary channel to this region. So, ibig sabihin, pwede mo gamitin yung mga LI points for mastitis, no? What is mastitis? Nagsuswell yung breast, nag-inflammation. Myalgias, muscle pains, and thoracic pain. Okay? Myalgia, muscle pain, thoracic pain. So now you're all excited, I'm sure. Next, we go to the large intestine sinew channel or the large intestine muscle channel. So just like the lung muscle channel, it covers a wider area than the primary channel. So it originates at the tip of the index finger, and then it connects at the dorsum of the wrist. Dorsum, okay? Dito. Ascends across the forearm, and then it connects at the lateral aspect of the elbow, then up the arm to connect at the shoulder. A branch will enter the scapula. You can see it here. And then it attaches to the spine. Okay? Kaya napakaganda nito gamitin. That's why you may always want to use LI points on shoulder issues, no? The main channel proceeds from the top of the shoulder to the neck, okay? Where a branch separates and connects it at the side of the nose, dito. The main channel continues upward, anterior to the small intestine muscle channel. And then it crosses over the head, connecting at the mandible on the opposite. Can you see this? A mandible on the opposite side of the face. Pag LI, opposite talaga yan pag sa mukha. Okay? Yon. So what is the clinical importance of this one? Okay, for pathology, may mga cramps, pain, tension, and stiffness along the LI sinew channel. Cramps, di ba? Muscle. So it's a muscle channel, sinew channel. Limited range of motion of the upper limbs and shoulders, occipital pain, stiffness, limited range of motion. Indication niya is mainly for B syndrome, which we also call the painful obstruction syndrome. And I'm sure you know what that is, along the LI channel. So the area covered by the LI sinew channel is larger than that covered by the LI primary channel. So this explains why indications of points sa LI primary channel include disorders and diseases of the upper neck and thoracic region, as well as of the whole face, katulad ng frontal and temporal headaches. Okay, so now let's go to the most exciting part. May I call on, uy, marami-rami na tayo. Oh, Ma'am Ami Glorioso. Ma'am Ami, good evening.
Good evening.
And belated happy
Good
birthday.
evening po. Thank you, Doc. Good evening, everyone.
Okay, can you answer one?
Um,
Let's start with number 1. LI4.
Okay, Doc. Number 1, LI4 is, my answer, Doc, is for letter E. Disperses wind, relief exterior, common cold, facial paralysis, and hemiplegia.
Hemiplegia. Okay, what is
Yes.
LI4 classification?
Yung source po ng LI channel.
Very good. Okay, correct. Number 2, LI5.
Number 2, LI5 is for letter B, expel wind and fire, headache, tinnitus, and toothache.
Okay, what is so special about LI5?
LI5 po, Doc, is good for shoulder.
Ano po yung classification niya in
Shoulder
terms of the
diseases.
5 shoe? I'm
I
sure you know that. Bago mag LI11. Di ba LI11 Hussey point? Remember?
yes po.
So LI5 is what is the classification? Kasi we need to know the classification para malaman natin kung ano yung functions niya. Okay? So ano po yung classification ng LI5? Pili ka lang sa 5. Is it Jingwell? Is it Ying Spring? Is it Shoestring? Is it Jing River? Is it Hussey Point?
LI5, Doc, is
LI5 is na-stress si Ma'am.
451 po.
Jing River.
Jing River po.
River.
Jing River.
Oh, Jing River. Yon. Kaya maganda siya for expel. Yeah.
Disperse.
Yes. Oo. Galingan natin mag-Google ha. Ganito tayo ha. Like every point that you meet, you need to know what is the special feature. So subscribe to Puncture Matters. Okay, number 3, LI7, Ma'am Ami.
Ang LI74 is
What's your
a
answer?
cycle point siya.
Mhm.
So ang my answer, Doc, is letter D. Clear heat, stomatitis, parotitis, glossitis, mouth ulcer.
Glossitis. Namapiga yung tongue.
Parotitis, glossitis, mouth ulcers.
Parotitis.
Left side po siya.
Wait lang ha, ganito masanay na kayo.
Glossitis.
Parotitis, glossitis, stomatitis,
Mouth.
itis lahat yan. Inflammation. So, there will be pain, di ba? Kasi isa sa mga component ng inflammation is pain, dolor. Okay? So, when we take up biomedicine, alam na po natin yan. Cardinal signs of inflammation. Oh, nakakaya kay Dr. Sam pag hindi natin tinake up yan.
Or pain po.
Okay, di ba nakakatuwa pag sa lamp? Oh, di ba? Okay, so that's the she cleft point. Very good. What about LI10? First, ano po yung class?
Ang classification po ng
LI10.
LI10 is
Ay nako, favorite ko yan sa ano, sa mga shoulder pain. Hindi naman siya wala siyang classification.
wala po.
Actually, pwede nating i-alternate siya with LI11. Usually, pag may shoulder pain, i-probe mo muna kung masakit siya talaga, i-needle mo siya. Very effective. Okay, LI10. What is your answer for LI10? Letter?
The answer, Doc, is letter G, or
Okay.
harmonizes the stomach, ulcer, stomach ache, and abdominal pains.
Okay, why is it effective for the stomach? Well, why can this be used sa stomach? Ano bang connection ni large intestine kay stomach?
Nag-harmonize po, Doc, or stomach.
In terms of
May connection po
elements.
siya.
Di ba same
For
polarity?
diary,
Same
same
polarity.
polarities po. Opo.
Ano pa ba? Sino ba yung
Po siya
mother
ng-
sa dalawa? Si stomach or si LI? Anong element ni stomach?
Stomach po is earth.
LI.
Earth po siya.
LI?
Ang Li po, Doc, is earth po, mother of metal.
Metal. Diba?
Yes po, metal.
Earth is the mother of metal. So, anong
Yes,
answer mo sa LI10? Letter G. Okay, hinaharmonize
Yes po,
yung
letter
stomach.
G. Ina-harmonize po ang stomach.
Okay, very good. Number 5, LI11. Anong classification?
Li11, PC and earth point of the large intestine.
Wow, very good. Great. Then,
My answer, Doc, is letter A. Cool heat elevates dump, regulates blood, high fever, hypertension, hemiplegia, and measles.
yeah, kaya C-point kasi, di ba? C-point.
Yes.
Okay, tinapos sa dagat. 11. High fever. Okay. Hypertension. Okay, next, number 6, LI16, classification.
Li6 is for loop
No,
connecting point of the large
LI16.
intestine.
LI16.
Li16. Li16 is a Yangming for large intestine meridian.
Crossing point of LI meridian and the Yang Chow vessel.
Yes, po. Large 16.
Okay. LI16 is, yung answer mo is letter
Letter ano po, Doc? Letter C. Letter C.
congealed.
Disperses wind, relieve exterior, common cold, facial paralysis, and hemiplegia. Tama po ba,
Answer
Doc?
mo is letter?
Letter C po.
Okay. Bakit may nabasa kang hemiplegia?
Doc, sorry po. Disperses congealed blood, clears the channel, diseases of the shoulder, spitting blood, and scrofula. Sorry,
Yeah.
Doc.
What is a scrofula? Google. What is a
Scrofula.
scrofula? Yung mga may glandular
Yung
swelling,
lymph
usually
nodes.
TB yan. So dito mo makikita na mayroon talagang relationship si lungs kay LI. Diba? Yon, along the LI channel. So this the point is LI16 for scrofula. Number 7, LI20. First, what is the classification of LI20?
Ang LI20 po is the meeting point of the LI and stomach channel.
Okay, good. That's why we also use that for oculift, right?
Yes po. Dahil sa stomach channel.
So if you needle LI20, you also affect the stomach, and we need it very badly if you want to look young. Okay. Ano po yung sagot natin dyan?
My answer, Doc, is letter F. Opens the nasal passages, rhinitis, facial paralysis, roundworm in the bile duct.
Okay. Dito mo makikita
Letter F.
connected siya sa may bile duct is nasa ano na siya, liver gallbladder, di ba? Sa hepatobiliary system. Okay. Thank you very much, Ma'am Ami. Good job.
Thank you po, Doc. Thank you.
Now let's call on the last one. Can we call on, sino pa ba yung gusto? Teka. Ma'am Joy, you might want to try this out. Did you?
Sige, Doc. Sabi niyo ako yung next eh. Sayang sa tama pa naman yung sagot ko kanina.
Sige.
Ngayon, hindi na natin sure kung tama.
Ay, gawin mong
But
tama.
I will.
Oh.
Pag mali, di, Doc, itama nyo na lang.
Eh, ganon. Tama nila. Okay. Easy.
Okay, number 8, Doc. Which point should not be used in pregnancy?
This is about
LI4,
LI.
Doc.
Ang galing. Okay. What's the water point of LI?
Water point is LI2, Doc. Also, the sedation point.
Horary point of LI.
Horary point, Doc? LI1. Kasama po ba yun yung sa horary point sa question?
Wala. Gusto ko lang
LI1, Doc.
ano mo lahat ng mga points. Okay. Luo point na may lung indications.
LI6 po, Doc.
Okay, very good. Number 11, associated with the stomach at stomach.
Number 11. Ito, Doc, not sure. But my answer is LI10.
Yeah.
Tama ba?
Yan ang tama.
Tama po. Thank you, Doc.
Kasi tingnan mo yung position, ito na yung papasok yung balancing, remember? Nakita mo, you analyze yung position ni stomach 36. Tapos ni sa opposite.
Yun ba, Doc, yung ano ng same polarity? Mga ganun.
Nagets mo? Okay, ang tanong ko sa'yo, ano naman yung, okay, ganun na lang. Okay, basta, stomach 36, LI,
and LI10.
LI10. Very good.
Okay.
Now, for sounds in the throat like a duck.
Okay, ito, Doc, hindi na ako sure. Pero LI18, yung answer ko, or 17. Kasi pareho silang sa throat, Doc, di ba?
Yeah. Did you Google?
So sino po sa dalawa?
Of course, the benefit of the throat, syempre, anything sa throat. Sino doon? LI18 and?
And 17, Doc. Yung sagot ko. Wait lang po, Doc.
Hindi masyadong sikat si 17.
So hindi po masyado
Take a look at
so kaya
LI7.
18 po yung una kong sagot. Pero, saan, question po pala, Doc, saan ito tinutusok?
Doon sa hindi sa throat. Sa
gilid? Or sa gitna?
What
Like,
is the definition of LI18?
Di ba po yung LI18 kasi it's sa, lateral side of the neck. Ito po hinahanap. Pero so pagka parang, pag inaano ko po kasi siya.
You have to avoid the pulsation.
At baka yung, matusok ko.
Hindi naman, kaya nga ano lang, 0.5 lang. Saka paikutin mo talaga yung neck niya. Di ba, Ale, pag nag-ano tayo,
Oh,
sa
sa needling po ulit, Doc.
needling
Tuturo
ulit,
niyo po
yun
ba
ang
yan?
una-una mo itutusok. Yung stomach 9, LI 18.
Lahat ng mga mahirap, Doc.
Yes, pati bladder 1. Okay, great.
Wow!
Next, improve psychic vision.
LI 14, Doc.
So how do you classify LI 14? Why is it special?
LI 14, actually, Doc, hindi ko rin po alam kung bakit for psychic, ano to.
Okay, according
Kasi,
to Google,
ang
acupuncture.com.
nakikita ko lang po dito sa aking, sa aking app ay only talks about neck convulsions and crampy pain and scrofula and eye diseases. So, for psychic, Doc, I just based it on your notes.
Actually, meron
I
siyang
will be
diminishing.
honest.
Alam mo sa Chinese, pag sinabing vision, hindi lang siya puro vision yung nakikita mo. It's also about
Hindi lang po physical.
It's also about the future, mga ganon. Yun. So,
Oh,
LI
okay,
14,
gets.
very, very famous. What's this? Because it's the crossing point ng LI, SI, and bladder meridians with the Yangming vessel. Yeah, okay.
Oh,
Yeah. Okay,
ganun
number
po pala yun.
14.
Number 14, Doc. Main point for high fevers, high blood pressure, and skin diseases. LI 11, Doc.
Okay. What's the tonifying point ng LI?
Tonifying. LI 11 din, Doc. Di ba po?
What's the sedating point of LI?
LI 2, Doc.
Okay. So, ibig sabihin, ito tonify mo yung LI, di ba? When you treat high fever.
Yes, Doc.
Is that so? Why is that so?
Ay, wait. Wait lang po, Doc.
You analyze, LI 11 is a tonifying point. So, when you tonify, you're actually
Yes.
strengthening the LI.
Oh,
So, why do
kasi
you
dapat
use
po
that?
isa-sedate.
Bakit mo siya gagamitin sa high fever? Eh di lalong tataas yung fever, di ba? What is the reason?
Oh, so ay, teka lang, Doc.
Isipin mo.
Wait lang po,
Ganito,
Give your
as much as possible, ayaw nating yung fever niya hindi bumaba. Gusto natin bumaba bigla. Now, pataasin mo na muna para konti na lang yung time. Kasi baka umabot pa ng more than 3 days. So, kaya ito tonify natin siya, no? Especially in cases of high fever. But basically, pag mainit, like may heat in the blood, we sedate it. Pero kung tutuusin, why do you have to tonify it? Para di ba, pag katapos ng yang, mag-yin siya. So, ibig sabihin, para mag-shorten na lang yon, i-tonify mo na, pabibilisin mo na.
Oh.
Kasi
So
eventually, bababa ang fever. Bakit mo pa patataasin? Siyempre,
there's no going up anymore. Parang ganun po ba, Doc?
yeah. So parang, kasi tataas man din lang siya, pataasin mo na lang para bumaba na siya. Ganun yon.
So gagamitin pa po ba yung LI2 or hindi na po?
Hindi na. I-tonify mo lang talaga yung, especially pag grabe yung lagnat ng pasyente mo, lalo na pag anak mo, no? Wag naman. So, pataasin mo na para bumaba na. Kasi pag bumaba na yan, kaya pinapawisan niya, nag-yin na. Di ba? Nagpapanik kapag hindi pa pinapawisan. Hindi pa nagsusweat.
Yes, Doc.
Yes? So, if you want the process to be shortened, then you have to what? You have to make
tonify
the process fast. Ito tonify mo.
Nalagay ko po ito sa notes ko, Doc.
Yes. Only for high fevers. High blood pressure, pataasin mo. Yung wag na pag high fever.
Paano, Doc, kung sumobra? May possibility po ba yan, Doc, na sumobra?
It is only for high fevers. Kasi pag high fever, especially pag first day pa lang, second day, ay mo umabot ng third day. No?
Yes, Doc.
Paiikliin mo lang. Pag skin diseases, high blood pressure, isi-sedate mo siya kasi aalisin mo yung heat. Kasi usually yan, medyo matagal na yan, skin diseases na yan eh. O high blood pressure, karamihan na pumupunta, alam na nila may high blood pressure na sila, minsan 1 taon na o 2 taon. You will not use the same process, baka lalong tumaas din na stroke na tuloy. But
So,
for
Doc, itong ano na high blood pressure, ano po to? Like, kunyari, for acute or chronic high blood pressure?
both acute and chronic, you have to sedate, but only for cases of high fevers, yung talagang ano is pataasin mo na lang para bumaba na kaagad, para pawisan na kaagad. But it's a different story pag high blood pressure. Ang high blood pressure, gusto mong bumaba siya. Bakit mo ba siya patataasin muna? Eh mataas na nga eh. 'Di ba? Kasi lahat tayo, as long as merong pathogen na pumasok, nagkakaroon ng gyera. So, palalakasin mo na, patapusin mo na yung away para wala ng problema. Ganun lang. Yung high fever, skin diseases. Oh, sa totoo lang, hindi lang puro LI11 ang gagamitin mo. Actually, my favorite for skin diseases is spleen 10 and bladder 17. It's so effective. And also GB31. Empirical point. Hindi mo malaman kung bakit. Pag sinabing empirical point, hindi mo alam bakit yun ang ginamit. Okay? Congratulations, Miss
Okay,
Jo.
Doc. Thank you, Doc.
So good. So, hope to see you again next week. Now, let's do a little roundup, no? Hindi pala little. Tonification point, as we said earlier, is LI11. Sedation point is LI2. Horary point is LI1. Memorize mo na kahit iba yung points. The main points are LI4 and LI11, which are often used together. Diba? Yung isa pang tanggal ng wind, yung isa pagbabad. Okay, LI4, stronger for wind or chi. LI11, stronger for heat or blood. Gets? So ito, yin to eh. LI11. Di ba blood? No? Chi. So heat or blood, you use LI11. Wind or chi, you use LI4. For headaches, mas common ng LI4, but I would suggest na gamitin mo to sa yung anatomical snuff box. You look for that. Ha? Di ba yung saan nilalagay yung pinapaa mo yung perfume pag gusto mong binibentahan ka. You can also use that point to stop smoking. Okay? But of course, it will not happen overnight. LI6 is good for facial edema, breathing. And then LI7 for mouth and tongue inflammations. Okay? LI8 for the small intestine, LI9 for the large intestine. O tingnan mo, nag-iba na sila ng parang in-expand nila yung nila. Kasi small intestine and large intestine, ano lang yan, di ba? Parang magkapamilya talaga. So you use LI10 when you have stomach and abdomen pains, or you can even use stomach 36. I also use that for shoulder pains. Okay? Kasi 'di ba, shoulder, andyan din yung LI15, no? Okay, LI11, especially
question ko, sorry, for shoulder pains. Sorry, Doc. And for trauma on the shoulder, same din po ba?
So when you talk about trauma, the main concern is yung pain muna ma-relieve. So it doesn't matter kung basta ang importante mawala yung pain. And at the same time,
Okay, Doc.
hindi siya magpasapas. Kailangan mag-circulate yung dugo.
So, pwede rin po yung LI10 doon, Doc.
Yes.
Yes. Okay. Thank you, Doc.
LI14 for eye problems, psychic powers. O, diba? LI15 for shoulder problems. LI16. What is the medical term for coughing blood? Anyone? Anyone? Coughing blood.
Wait.
Hemoptysis.
Yes, wow.
Yes, hemoptysis.
Ano naman yung nagsusuka ng dugo? Hematemesis. Oh, ano naman yung umiihi ng dugo?
Hematuria.
Hematuria. Okay? Hematuria. Ano naman yung ano yung hematochezia? Nagtatain ng ano. Wait lang. Nakalimutan ko na. Matagal na kasi ako na. Wait lang. Hematochezia. Does everybody know what is hematochezia? Sige, consult.
Blood in the stools.
Yes, very good. Hematochezia. Oh, di ba? O di ba parang magulat yung iba? So if you have sinuses, clogged sinuses, we need to use LI20. And we hope you'll be very good at needling that without any effort. Thank you very much for joining. Okay, asan na yung ating president? The real president. Okay, nandiyan pa ba si Albert? Nawala.
Hello, Doc.
Albert, yeah.
Wala pa yung guest
Wala ba
natin.
sila?
Wait lang, Doc, ha?
Sige lang,
Wala
wag mo
pa, Doc, eh.
nakakahiya
Nakapasok.
naman. Okay, baka naman gusto nilang marinig yung mga news mo. Hindi ko lumaki yung
Okay po.
Okay.
Ayan, hello po. Good evening, everyone.
Yan. The real
Good evening po, President.
real president, press proc. Okay. Sige, go. Bakit parang sinasapian?
So, anyway, we have a lot